Okay, Max, we are now broadcasting.
Should I give everybody 2-3 more minutes?
Yes.
Dear. Okay, shall we get started?
Yes. Yep.
All right, well, in that case, good morning, afternoon, evening, depending on the time zone. We've kind of got a span, I think, from at least from Toronto to Singapore. I'll start kind of very briefly introducing us and the idea behind this roundtable. My name is Max Scalin. I'm a research fellow at the Institute of Development Studies and at the International Center for Tax and Development. My colleague, Vanessa van den Boogaard, who is also a research fellow at IDS and ICTD and is based at the University of Toronto. We're leading a research project on informality and taxation within the ICTD. And as may be the same for many of you, as the COVID-19 pandemic has spread across the world, this increasingly began to change kind of not just the groups and circumstances that we were looking at, but also the conversation we were having with colleagues, academics, activists, policymakers, trade unionists from various countries around the world. And we're increasingly finding that we're all having the same conversations, asking ourselves the same questions around informal economies and this crisis. So this roundtable is kind of an attempt to bring these conversations together and bring together some of the people we've been having them with. So when we thought of this, we thought that ideally, maybe there's a dozen or 24 people who'd be interested in this. When we checked the registration this morning, I think 360 people signed up for this. So we had to cap the Zoom number, and more people are following us on YouTube. And we're thrilled with this interest and really looking forward to this conversation. So from kind of our perspective, I think there's about kind of 3 central pillars to this conversation. I think there's the effect of the pandemic on informal economies, the effects of the relief efforts that we're seeing around the world, and then kind of the role that research can play in this. And I'll start with some very brief remarks on these and then hand over to our speakers. So as I think nobody in this virtual room needs telling, workers in the informal economy across the globe have been particularly vulnerable to this pandemic. They've been vulnerable from a health aspect. So working in crowded market spaces, in their employers' homes, or as transport and care workers, they're frequently on the front lines of this pandemic. At the same time, their access to healthcare is often restricted. The absence of institutionalized sick pay can create a direct trade-off between caring for their health and sustaining their livelihoods. And they've been vulnerable financially, especially in the context of widespread lockdowns. Many have lost their main source of income. Working from home is impossible for many. Savings and access to finance are often limited. The effects that both kind of potentially new stigmas around informality and hygiene and a global employment crisis will have on livelihoods in the informal economy in the medium terms are also hugely worrying. So even though they are particularly vulnerable, many relief efforts have passed them by. A significant set of economic programs around the world that were aimed at kind of bolstering the economic shock have been built on pre-existing institutional relationships between states and businesses. They've come in the forms of tax relief, delayed tax filing, or payment deadlines, many of which, of course, don't reach business in the informal sector. The same is true for specific bailouts, which are typically directed towards larger enterprises, and wage subsidy or furlough schemes that target workers with a formal employment contract. One of the few policy tools that are often more specifically cited at being aimed at reaching the informal economy are direct cash transfers, which, according to Gentili et al.'s tracker, currently make up about a third of the social assistance relief efforts that we're seeing across the world. And they do appear to provide one of the very few policy tools that can provide relief at something resembling the pace that is needed in order to support informal livelihoods in these days. However, needless to say, there also appear to be enormous implementation challenges. We've frequently seen governments build payment targeting on pre-existing social welfare registries, which don't precisely map upon the population of informal workers. At the same time, efforts to kind of more quickly register informal workers face a variety of issues, from accessibility to the future use of this data. And crucially, we think that there is also a long-run aspect of these relief efforts that will affect informal economies and that is now frequently overlooked. And that lies in the medium-term fiscal relationships between states and informal economies. Once the kind of dust settles on this first wave of health and economic relief efforts in this pandemic, countries around the globe will find themselves with severe fiscal deficits and expanding public debt. Particularly in the global south, the tax bases of many countries are relatively narrow. And we think that it's quite likely that broadening the tax base through extracting revenue from the informal sector might again become a policy priority. I'm not going to outline all the issues around taxing the informal economy here, but just note that particularly in a context where these efforts are driven by a need for revenue extraction, there are enormous risks that they will lead to further marginalization, harassment, and the overtaxation of small businesses that are already paying a large range of formal and informal fees and taxes. There are huge challenges ahead, both in the short and the long term. And with that, I will head over to Vanessa.
Great, thanks, Max. So as Max has highlighted, we know that the effects of COVID-19 are unequal. While the virus itself may not discriminate, the underlying inequities embedded in social, economic, and political structures mean that the impact of both the virus and the containment measures are affecting different populations differently, with particularly devastating impacts for vulnerable populations and workers in the informal sector. So in addition to talking more today about the impacts for the informal economy and informal sector workers, we also want to open a discussion about the role that research may play in supporting policy responses, both during the crisis and in the post-crisis recovery period. At the ICTD, we've begun to discuss these potential roles for research more broadly. We've been, focusing our discussion on three key points that I hope we can broaden that discussion today. So first, we've been thinking just in general about the challenges of how to go about collecting data in the time of social distancing and lockdowns. These are raises questions about how to access research participants safely, introduces new challenges of conducting things like mobile phone surveys, and ensuring a representative sample when doing so, recognizing in particular that mobile phone ownership and internet access is inequitable and often gendered within communities and within households. The second point that we've been discussing is how existing or ongoing data collection can be adapted to address pressing data needs. So including thinking about how existing sampling frames can feasibly and ethically be used to track the impacts of the global pandemic to better target relief and responses. But this, of course, presents particular challenges for focusing on the impacts on the informal sector, as often these sampling frames, existing surveys simply don't exist. So we've been thinking about how we can go about working with local partners, including organizations like informal labor unions, to better capture workers in the informal sector, to reach people that are often hidden or not included in government registration processes. And third, we've been thinking about how research outputs can link to and support policymakers and advocacy organizations more quickly and more directly. So not just thinking about the academic outputs of research, not just thinking about the paper that may be published in a year or 3 years or 5 years, who knows, but thinking about how we can make data available on a close to real-time basis to policymakers, to advocacy organizations, and to stakeholders to better inform evidence-based responses to the crisis and to target relief efforts more effectively and equitably. So we've been thinking about what that means in terms of partnering with policymakers and local organizations and making data available to them, accessible to them, and more relevant. So that includes ensuring that we're asking policy relevant and useful questions. So these are some of the key points that Max and I and the rest of the team at the ICTD have begun to think about in terms of the effects of COVID-19, the relief responses, and the role of research at this time. So I'm not going to waste any more time. I'd like to pass the floor to our panelists to share their thoughts about these different elements, about the impacts on the informal economy, the effectiveness of existing policy responses, or the type of relief efforts that would be more appropriate, and the challenges or opportunities for research to support policy and advocacy at this time. In terms of formats, we're very lucky to have 4 wonderful panelists today. They'll each be giving about 10 minutes to present. We will be holding all questions until the end of the presentations, after which we will be opening the floor to a broader discussion. So if you have questions, we'll ask that you follow these protocols. So if you're on Zoom, we'll ask that you note in the chat or raise your, I think there's a virtual hand function that you can raise your hand to note that you would like to speak, or you can pose the question directly in the chat and we'll make sure that it's addressed. If you're joining us via YouTube, you also have the opportunity to include questions or comments in the chat function there. We'll be monitoring that chat to make sure that you are included in the discussion. If you're leaving comments or questions in the chat, we'll just ask that you identify yourself and your affiliation so that we know who we're talking to. And we'll remind everyone to keep themselves on mute if they're not speaking. And we'll note that we are recording the proceedings so that everyone is aware of that. So our first panelist today, we're very excited to have her with us today, is Kate Marr. She is an associate professor in development studies at the London School of Economics. She's published extensively on the informal economy, on non-state governance in Africa. She has particular expertise in Nigeria. She's a leading figure in the field, and we're very excited to have her perspectives on all of these issues. So thank you, Kate. I will hand the floor to you.
Hey, thanks very much. And thanks, Max and Vanessa, for putting together this interesting roundtable. It's particularly timely for me because this is coming right at the end of my option course in the Department of International Development at the LSE on the informal economy and development. So many of my students who had the last few weeks of their teaching virtually will have an opportunity to pull together some of the issues that they've learned. And with that in mind, I decided to pull together my comments through the framework of one of the issues we look at the course, which is a framework devised by WeGo, which they call the 3 V's: visibility, validity, and voice. And I thought that might be a useful way of thinking about what the coronavirus incident is making us see about the informal economy, and what we are still not seeing very well, or the different ways in which what is coming to our attention also includes other things from our attention. I'm going to try a little bit of fancy footwork. I want to see if I can show a little video clip, but we'll see how that works technically. This has been a great time of learning by doing electronically, since I am not a huge fan of electronic teaching. But on the issue of visibility, I think all of us have noticed that there are many ways in which the coronavirus context is really changing the visibility of the informal economy. Suddenly it's on the policy agenda, government is talking about it, labor unions are talking about it. We're more aware than ever of gig workers, of informal workers, as something that is on the news regularly and in policy discussions and raised by the opposition, which is not, especially in the UK, something we ever really expected to see, at least not now. So WeGo focuses very much on the idea of visibility of the informal economy, and they tend to speak of it in terms of statistics, making the informal economy statistically visible. But what we're seeing now is a growing political visibility. The implications of the informal economy for how we react to coronavirus are becoming much more politically visible. But it is interesting to note that the informal economy and informal workers are becoming visible not because of the risks that informality poses to informal workers, but because of the risks that informality poses to formal workers, to us, to the mainstream society. Informal actors and their vulnerability has become a risk to us in terms of our ability to control the spread of this virus, because it is difficult for them to sit at home when they have to earn an income every day. So it's important to note, I think, that the reason that we're looking at the informal economy and so interested in the informal economy, the reason that it has become politically of interest, is because suddenly their vulnerability, which has posed a risk to them for decades, if not longer, now poses a risk to mainstream society. There's also an increasing social visibility taking place as the inability of informal actors to deal with lockdown conditions is forcing them out into the streets, because in many cases they must work every day if they're going to eat, because of the risky lives that they lead and their need to seek safer conditions. And let me just try and see if my technical skills are adequate to do the task here. I want to share a clip which should be here. Just a little clip from a Nigerian news story. Okay, so many of us have been seeing stories about how people in the informal economy in Latin America, in Africa, in Asia are saying, what we fear here is hunger. Yes, coronavirus is a risk, but we face risks to our health all the time. We live unstable, unhealthy lives. What we fear is hunger. What we fear is intensified insecurity. So their own risk assessment is quite different from the kinds of risk assessment that are coming on the policy radar. And I have another screen here, just a little background.
Kate, really sorry to interrupt you. We couldn't hear the video earlier, so if there's another thing with audio, that might be a bit of a challenge.
Okay, all right. You couldn't hear that video?
No.
Okay, all right. Maybe I better leave it then. That's a shame. Okay, it was a clip of a person in the informal economy in Nigeria on the street side saying he cannot stay at home. There's no point in trying to stay at home when what you fear is hunger, and ask anybody here what they fear is hunger. Okay, so the key issue here is that what is happening is not only that the informal economy is politically visible, but in ways that obscure the real risks that they feel they face. The key risk for them is hunger and insecurity. The key risk for us is the risk that informality poses to our own health. In India, we see informal actors that are increasingly extruded into the streets as they try to find a way to deal with a reality that is made absolutely insupportable through lockdown. Lockdown has been impossible for large numbers of informal actors. And we also are seeing a new issue that is just beginning to emerge, in which one of the main sources of support and solace to which informal actors turn, the church, the mosque, is part of what's being locked down in many societies. Evangelical Christians and some Islamic groups are still continuing to hold mass meetings, in some cases because they've been exempted from lockdowns in Brazil, in Kenya, and in other cases because they overtly defy lockdowns, such as in the US. And that may create a more nefarious type of visibility for informal actors, the visibility of religious targeting, which we're seeing in India now, as Muslims are being increasingly targeted as sources of spreading coronavirus, but also as deliberately spreading it. It's being billed as a form of secret jihad. And we all know that this kind of religious targeting tends to fall hardest on people in informal settlement. Now, the second issue is the issue of validity. Validity is about the legal recognition of informal workers as valid workers, as legally protected workers who deserve the protection not only of social welfare protection, but the state. One of the things that coronavirus has done is it's changed our understanding of essential work. Suddenly, taxis have become much more essential when public transport is shut down. Migrant fruit and vegetable pickers in the UK have become viewed as much more essential now that they can't travel in from Europe. Street vendors and open market traders are essential because they represent core elements in the food supply chain, not only for the people in slums and poor areas, but also for large segments of the middle classes in many African countries. Temporary health workers are being regarded as essential as doctors and more formally employed workers are forced into self-isolation or even worse. But we often see here a form of recognition of informal work and informal workers and gig workers as essential in a way that is more affective rather than material, the kind of clapping for the NHS, but not doing anything about their salaries and working conditions. And the reality is that the material effects of the pandemic are still falling hardest on the poor. The kinds of support measures that Max mentioned often ignore the lack of documentation of many informal workers, the fact that they don't have tax records to show their lack of various types of appearance on regulatory registers, so that even when they're politically recognized, the infrastructure to reach them is more problematic. There's also the problem that the validity of their work and their need for basic social support is recognized. But in fact, the validity of them as workers, the validity of their need for sustainable forms of income is not recognized by the very law that is supposed to accord that validity. And you have in India and Nigeria increasing situations of large numbers of informal workers being interred in crowded slums and camps, being punished and beaten by police when they try to go out and look for work or find a safer place to be, so that they are most exposed to the recriminations of police, to the violence of police, whereas middle-class actors can often drive to the village, drive to their holiday homes with perhaps a moderate amount of recrimination, but certainly no physical punishment, no fines, the kind of severe lack of validity that informal actors face really doesn't fall on middle class actors who do similar kinds of things. And finally, the issue of voice. We are still—
sorry to really briefly interrupt you before you get to the final point. Could you unshare your screen so we can see you again?
Sorry. All right, I cannot see how my screen is. Oh, stop share. Okay, sorry about that.
Fantastic, thank you.
Okay, the final point is that I had a small PowerPoint, but since the first thing didn't work, it's better just to leave it. So the final issue is the issue of voice. There are many organizations, advocacy groups, labor unions that are struggling to keep the needs of informal actors on the agenda, to specify the specific needs when support is rolled out to the self-employed and doesn't reach the informal economy, to raise the issues of how this fails to reach gig workers and what needs to be done. Pushing for emergency food distribution, for including soap and water in the kinds of provisions made to slums. All of these things are more on the agenda, the kinds of immediate emergency needs that are there. We also have an increasing pressure for universal basic income in India, in South Africa, in Canada, variants of it in the UK. But thinking about what these emergency measures mean is what's not quite coming through in political voice. The push for a universal basic income, in many ways, it's not entirely taking on board the ways in which universal basic incomes can be used to marginalize the debate about workers' rights. Once you give them the basic income, the workers' rights issue is less thought about. Donald Trump, for example, as mentioned by Laura Alfers in some recent WeGo blogs, was proposing to excuse workers from making their social welfare contributions through the employment context in order to put more immediate money in their pockets, but that will starve these wider social welfare systems of funds in the process of putting money in people's pockets. Mahila Housing Trust is trying to shift the focus not just from emergency social measures, but also putting the health concerns of informal actors on the agenda. Sanitation, social distancing training in slums, how to adapt lockdown protocols to the real situations in which people live and help them work out ways when they can't get masks and they can't live in ways that don't involve crowding people into rooms, and they do have to queue for things. How to make those kinds of health provisions adaptable and workable in the situations in which they operate. But I think it's worth putting on the agenda that this mobilization, largely around emergency social protection measures, occasionally around emergency health measures, is taking our eye off the real ball, and that is the ball of labor rights. WeGo's work with informal workers to deal with immediate needs, I think, is really important, and it's really important to put on the agenda the actual immediate needs of informal workers rather than measures that aim to reach informal workers but actually fail to do so. But there are longer term labor rights issues, the material recognition of the unstable, insecure context in which informal actors are increasingly working. And these informal actors increasingly woven into the production systems and the value chains and the distribution systems and the social services that we all use. And I think it would be useful to think about the ways in which, just as business is looking at how they're going to turn this crisis into an opportunity, those who are articulating the political voice of informal actors, informal workers organizations, labor unions, advocacy groups, need really importantly to think about how informal advocates can turn this crisis into an opportunity, to keep our eye on the ball, to think politically about the real risks that informal actors are concerned about rather than the more immediate emergency risks that will then disappear once the pandemic has passed. And to think about whether our focus should be on universal basic income, should be on labor rights, should be on the status of self-employed and gig workers as workers, and about the legal validity and legal protection that goes along with that. And I'll stop there.
Thank you so much, Kate. That was a really wonderful start to this conversation. Your framework of visibility, validity, and voice, or WeGo's framework that you're using is really useful for thinking about what the distractions are, what the noise is, and how we can actually focus on what matters. So that's a really useful point. Some really interesting points too about the contradictions between funding emergency measures and focusing on emergency measures at the expense of financing or supporting sustainable welfare systems, and thinking about the contradictions between the priorities of the informal sector versus mainstream society and policymakers. So that's a really, really interesting start. Next in our presentations today, we have Rachel Moussier, who is the Deputy Director of the Social Protection Program at WeGo. And for those that don't know, WeGo stands for Women in Informal Employment, Globalizing and Organizing. It's a global network focused on securing livelihoods for the working poor in the informal economy with a particular focus on women. Now, Rachel has been leading WeGo's rapid appraisal of the situation for informal workers. So we're particularly excited to hear what she has to say about that process. So Rachel, over to you.
Great. Thank you, Matt. Thank you very much to you, Vanessa, and to Max for organizing this. And Kate, thank you for opening up this discussion. I think you've captured, I mean, certainly some of our key issues around the 3 Vs, but I'm going to take this time and I'm going to share my screen with you so that you can see a quick, there we go. Let me know if you can see that. Yeah.
Yep.
Great. All right. So as Vanessa said, we have just done a rapid assessment. Hold on 1 second. So we've just done a rapid assessment of informal workers, the impact of both the health crisis and the economic crisis on informal workers. And in this presentation, I'm going to look at the key findings from the rapid assessment, and then look at some of the emergency relief responses and their inclusion or exclusion of informal workers. Some of this has been touched on, so I won't spend too much time on this. And then conclude with some research and advocacy priorities for informal workers organizations. So the rapid assessment was conducted between the 23rd of March to the 8th of April. We just published the results, or at least a sort of brief of the results yesterday on the website. It included interviews with 21 national or local member-based organizations, 5 regional and global networks of informal workers organizations, and all of this across Africa, Asia, and Latin America, as well as HomeNet Eastern Europe, so that would also be included here. WeGo focuses on 4 sectors within the informal economy. We look at domestic workers, home-based workers, street vendors and market traders, and waste pickers. And so the rapid assessment was focused in these sectors. The reason for this focus is that we find that women are disproportionately represented in these sectors, and they're also incredibly vulnerable sectors within the informal economy. So the rapid assessment, and there's a link in the PowerPoint that can also be shared on the Zoom chat, is that we looked at the public health measures and their impact on informal workers and their livelihoods. We did ask questions around health and the potential health impacts to informal workers, but at the time that this rapid assessment was done, many of our members were not yet feeling the health impacts. Neither were they themselves experiencing sort of COVID-19 symptoms, nor were their households, anyone in their households directly touched yet. There were some incidents, but it was very much marginal at this stage. We expect that to change, sadly. So just some key findings. The first is that we often think of the impacts in terms of the semi-lockdown or the full lockdowns, but actually many of the impacts to informal workers' livelihoods have been felt since January in some sectors. So in Southeast Asia, home-based workers have been seeing the price of their raw materials increase as soon as China announced their lockdown. They've seen a fall in their profits. They've seen a partial loss of income that finally materialized into a total loss of income. We've also seen that in the waste picking sector, the price of recyclable materials, be it plastic, cardboard, glass, has plummeted. And that's due to the lockdown, both in China, but also that then spread to Europe and North America. Finally, coming back to home-based workers within supply chains, particularly in the garment sector, once Europe and North America, and as well as China, stopped their contracts with in the garment sector, particularly in Southeast Asia and in South Asia, home-based workers lost a source of work, a demand for their work. We also saw domestic workers being blocked out of Hong Kong and Malaysia, so many migrant workers not being able to return to their employers. So I think what we see here is that by the time that public health measures are in place, many informal workers had already lost either a part of their income or are experiencing a total loss of income. The other key finding is that we are not talking about a temporary loss of income. Informal workers understand this as a permanent loss of income. And this is clear across all 4 sectors. And just to give you a few examples of what we mean here. In India, we've seen that the government has used the lockdown to break up street vending infrastructure, which means that once the lockdown is lifted, street vendors won't be able to come back to those spaces that they had negotiated and gained from the municipality. We've seen police harassment, as Kate mentioned, across all regions, and that's led to evidently physical abuse, but also to confiscation of goods, which therefore has implications for starting up work once that is possible. In Colombia, waste pickers have said that they are taking great risks on great health risks by continuing to work, even without the protective gear that they need to, in order to retain their control over the recyclables, so that private companies don't come in and take over their areas of work and take over the procurement contracts that they've been given. Domestic workers were the first to talk about employers losing their incomes and having no guarantee that they'll be able to return to work. And I think this is really important, and it links to Kate's point around emergency response versus sort of long-term responses, and how do we think about labor rights? How do we think about social protection within this context? Is that income support has been characterized by governments as a short-term, sometimes one-off measure. But the response needs to be, but social protection and cash transfers need to be an integral part of recovery packages. The final key finding that I want to highlight is that there's been evidence of increased care work for women informal workers. And again, this is across all 4 sectors. For domestic workers, there's been an increase in paid care work. Live-in domestic workers in the Middle East and in Southeast Asia have seen that their employers are now all at home. So their employers' children are also all at home. So they obviously have an increase in their workloads, and they're no longer able to leave the house at any point due to the lockdowns. In other sectors, or for women in other sectors, we've seen that their unpaid care work has significantly increased. And this started actually even before the lockdowns. This started, for instance, in Africa, before lockdowns were announced, in Kenya or in Tanzania, schools were shut. And so once schools were shut, it meant that women informal workers have been amongst the first to lose incomes. And because of their continued unpaid care responsibilities, until there's access to schools again and also daycare services, they're most likely to be the last ones to get back into work. And there's also a very high likelihood, as we've seen in other crises, that they will be pushed into the more vulnerable forms of informal work. So domestic workers who are waged informal workers are already saying to us that they're looking for self-employed opportunities within the informal economy, either through street vending, but that's much more, or that can be much more precarious. So that's certainly something that we are seeing. In terms of the emergency relief and tracking sort of the impact on informal workers, I want to say that we have started on our website, there's a sort of Google Doc that is where we're consistently updating and tracking the social protection measures, but particularly the cash transfers that are accessible to informal workers. There's already been mention of digital and financial exclusion. I don't have much time to go into that, but I just want to add that there's been an exclusion of less visible workers, particularly domestic workers and home-based workers, because they're in private homes. And because much of this work is women's work and gendered and therefore not visible. So that's certainly been something that we've seen in terms of which informal workers are eligible and which are not. Essential workers, Kate made reference to this. We are seeing that some informal workers are increasingly recognized, such as food producers and vendors and waste pickers. For instance, South Africa initially closed down all of its markets at the start of its lockdown, but decided to then 2 weeks later to allow some food vendors to operate again because they're so critical to food distribution systems. But there are also essential workers who are unrecognized. So live-in domestic workers who I've mentioned, home-based workers who are stitching masks and providing much needed face masks at the moment within the local market and for their communities. There's also very little discussion around the fact that many of these essential workers, be they formal sector workers or informal sector workers, require childcare in order to operate. And what of the childcare providers, given that daycare centers have been closed? Evidently, the battle that in terms of an immediate response is around ensuring that essential workers that are categorized as essential workers. That's certainly one of the areas that we're looking at, and also that they have access to protective health measures and protective gear. The rapid appraisal sort of led, or from the rapid appraisal emerged these guiding principles. These aren't new for WeGo, but I think it's worth noting when we think about our next steps in terms of research and advocacy, particularly not only for informal workers, but with informal workers. And in that respect, I'm going to focus on the last point, honor nothing for us without us. And what we've seen already on the ground is that informal workers organizations are negotiating with governments in terms of the design of cash transfer programs to make sure that they're included. This was the case in Thailand, in South Africa. We've also seen that they're critical in the delivery and relief of recovery measures, not just emergency, but in terms of substantiating the databases in terms of for cash transfers. Governments don't have this information. They're going to informal workers organizations, asking them for their list of members, because in the case of street vendors, for instance, not all of them are registered. So even if they operate within a market. However, they may be visible in informal workers membership. So, but I think I want to stress here that this raises an opportunity and also a challenge, as Kate's mentioned, around social dialogue. Cash transfers, in the way that they're not negotiated by definition, unlike social insurance schemes, which are or have tended to be negotiated through tripartite structures amongst it within the formal sector by government, employers, and formal sector workers. Social assistance doesn't have those inbuilt social dialogue measures. And actually, this does pose a risk for us, because to what extent, can we can I identify these examples, but we also have to work in broader coalitions. And I think that's emerging already through the rapid assessment. In Thailand, the informal workers organizations that are part of the WeGo network have been collaborating with trade unions, but also sort of civil society organizations working on poverty alleviation. And I think broader coalitions, because we don't have that institutional power as informal workers organizations, must be drawn on to ensure that cash transfers are embedded in social dialogue. I think in terms of the next research and advocacy priorities, we will be doing a next round of rapid assessments in 2 months' time. I think we are expecting to see, unfortunately, more of a health impact as COVID continues to spread. I think that the other issue that came out strongly was the desire to, across the WeGo network, was to develop a sort of livelihoods recovery and resilience framework. And that's really about being prepared for the economic recovery packages that will be emerging now. What do they say about formalization? What is our position on formalization? We've developed this as we go already, but how do we how do we present this within and take this forward in discussions around economic recovery packages? I think the other thing is around the extension of social protection programs beyond the emergency period. And of course, the link between social protection and access to public care services, and particularly healthcare and childcare, have emerged as key areas in terms of our next steps in our advocacy. So I'm going to leave it there. I think I'm out of time, but thank you very much.
Great. Thank you so much, Rachel. That was really useful. Thank you so much for sharing that data and the ongoing research. It's so useful to have a sense of the experiences across the global context and then the diversity of places that you collected that information, but also the diversity within the informal sector. So recognizing that certain sectors and certain trades are going to be affected differently, and also thinking about the longer term impact, right? So not just how this affects people in the short term, but the long term. So that's really wonderful. We really appreciate that. Our third panelist today is Umar Javed, who is an assistant professor at the Lahore University of Management Sciences. He is a sociologist that focuses on politics, developments, and urban informality in South Asia. So we're particularly interested to hear his perspective of the impacts of COVID-19 on the informal economy from a South Asian perspective. From what I understand, he's also an avid football and cricket fan, and Twitter tells me that he shares my birthday. So I will cede the floor to a fellow Leo.
Thank you, Vanessa. Thank you, Max, for putting this together. It's great to be here. And obviously, some really important points have already been made by Kate and Rachel. I think I just wanted to sort of, so for my 10 minutes, what I'll do is I wanted to focus on the case that I'm looking at in more detail, which is Pakistan, which is where I'm based. And see how some of the factors that have already been identified in the discussion so far, in particular factors related to sort of long-term recovery, factors related to the visibility of the informal sector on the political and the socioeconomic agenda, but also factors related to the voice and how a voice of the informal sector and obviously particular segments within the informal sector and the impact that it has on outcomes. So I have a presentation that I'll sort of just quickly go through. Some of it is I guess it's not that important as far as sort of these larger points are concerned, but I thought I'd sort of set the stage as far as the Pakistan case in particular is concerned. Is it visible? You can, Max, if you can just nod if the presentation is visible or not. Okay, great. Basically, what we're looking at here in the case of Pakistan in particular is sort of a significant impact on the informal sector. And part of the reason is that the informal sector and the way that the informal sector is defined in Pakistan is obviously we're looking at self-employed or own account workers, casually employed laborers and apprentices, and owners and employees in smaller micro enterprises. And I think one of the important things that the numbers tell us is the distribution, both the sectoral distribution and the occupational distribution of the informal sector, because that I think has strong implications for how the virus and obviously the effects of the virus and the public health measures that have been taken around the virus, how they impact the informal sector as a whole. So for Pakistan, we're looking at about 72% of the total non-farm workforce is informally employed, and the trend has been pretty much consistent for the last decade. In terms of absolute numbers, we're looking at about 27 million individuals or 27 million earners. This would, I mean, in terms of the number of households in the country who are in some form or the other associated with informal work, we're looking at sort of greater than maybe 50% of all households. And of these 27 million, we'll see about 13 million residing in major urban localities. By employment status, about 47.5% are employees. So they're working in other sort of informally organized businesses, mostly those businesses which aren't registered with tax, social security, or municipal authorities. And then we have about 45% of this, or 11 million, are own account workers, which obviously, or the self-employed category that is often used in other country contexts. What I think is quite telling, though, is as far as the subject that we're looking at is the sectoral and occupational distribution of the informal sector. And this is pretty common across, I think, a number of country contexts. So Pakistan isn't unique in the way that you see a pretty significant concentration of the informal sector workforce in wholesale and retail trade, in small scale sort of manufacturing, in the construction sector, in transportation, but also, and this is, I think, quite tied to urbanization, in things like community, social, and personal services. So this would include, so for example, domestic help, care workers, people associated with the waste economy. And that is also reflected largely in the way that the occupation structures operate within the informal sector workforce. The impact so far that we're looking at, so I mean, there are obviously two broad streams of impact. One is obviously the public health risks that are associated with the virus itself. I think we're looking at informality in two different ways. So there's informality and economic precarity, but there's also sort of informality in terms of the spatial spread and where the informal sector workforce actually, you will find them in major cities, right? So about 45.5% of urban residents in Pakistan live in fairly densely populated informal settlements. And there are pre-existing baseline health conditions or health and sanitation conditions that make these areas quite precarious as it is. And a lot of these issues are then sort of, one would say that they would escalate in the case of sort of transmission. And we've already had several cases of fairly significant transmission or local community-based transmission of the virus happening in these informal settlements. So I think that's a real health risk, which I think isn't being talked enough about. I think that's really, that in itself tells you something about the way that the conversation is happening around public health in a number of countries. And I think what is sort of being considered in a little more detail is the socioeconomic fallout of some of the public health interventions that are taken. So in Pakistan, we've experienced sort of a lockdown, a stage 2 lockdown, pretty much for the last month or so. And that's directly impacted the informal sector in a number of ways, largely because stage 2 lockdowns include the shutdown of intracity public transportation, includes the shutdown of the construction sector, of the manufacturing sector, and non-essential wholesale retail as well. So any business that doesn't sell sort of essential items or groceries or medical goods, they've basically been shut down over the preceding 3 months. Some preliminary interviews with people who work in large marketplaces, mostly wholesale marketplaces, have already confirmed the extensive dislocation of street vendors, hawkers, and migrant labor. So that goes back to this earlier point that a lot of the existing informal retail infrastructure is also being it's being displaced in this time period when lockdowns are in place. We were also seeing some level of repressive action on part of state authorities to enforce the lockdown, which really is, and the debate, I think in Pakistan's case, has sort of, it's come back to this larger point about whether whether the country can actually afford a lockdown, and what that means for obviously livelihoods and people's subsistence, right? And some estimates or initial estimates that we see in terms of sort of the number affected in terms of an income shock, there are about 11 million earners. So that's about 1/3 of the non-farm labor force in the country. But obviously, I think this is a really low estimate. The actual estimate would probably be much higher. I think one last point that I think deserves mentioning is just the precarity that lockdowns have generally created for migrant labor in particular, because you've also shut down public transportation, you've shut down other modes of transport, informal, for example, transportation services, and many are stranded in places of work or in temporary residences where in urban centers, and don't have the resources to sort of travel back. Or to even afford taxis, for example, that can take them back to the rural or peri-urban centers where they actually came from. I think this is, I'll just sort of briefly go over this. I think some of the existing vulnerability indicators really show how the informal sector is the one that bears the brunt of these sorts of the virus itself and some of the fallout that's taken place. Because if you look at the vulnerability and where it's concentrated, it's usually in places like wholesale and retail trade, in hotels and restaurants, transportation in particular. And I think that's really sort of become quite clear, categorical from Pakistan's case as well. So what have been some of the responses? I'll quickly go over what the government has been thinking about, what they've done so far. So as Max, I think, mentioned at the start, Pakistan's strategy is pretty much in line with what we've seen in 81 other countries. So the Gentilini Social Protection Appendix is put up 143 social protection programs that use cash transfers in across 81 countries, and that's Pakistan's primary intervention here as well. So we're looking at about a cash transfer program of $870 million. The disbursement to date is about 110 million. We're looking at a total of 12 million beneficiaries, so one per household, and they receive about $73 million. So it's a one-off payment of $73 that's supposed to last them for 4 months. And it's an expansion of an existing cash transfer scheme that already that's been in place for the last decade or so. And there are a number of issues with that. And I think it's worth sort of going into details is that if many countries are pushing cash transfer programs, then are we sort of even clear about what cash transfer programs, who are cash transfer programs actually targeting? What are they basing this particular strategy on? And whether they're actually reaching out to populations that are the most impacted by this virus. Some other interventions that have been taken are, there's a small scale cash for tree plantation public works program. Again, it's very localized and doesn't sort of reach out to a sufficient number of people. There's some food ration distribution through web-based enrollment. And there is, interestingly enough, there's a lot of conversation on easing lockdown restrictions on the construction sector because that's a major source of employing daily wage laborers and the informal sector workforce as a whole, and businesses that are linked to it. And that's a conversation that's been happening these days as well. So, and finally, the last, I think, response that we've seen is utility bill deferment, which I think is probably one of the more creative ways of reaching out to workers who might otherwise be excluded from existing poverty databases. Now, what are the gaps in particular as far as these measures are concerned? I think poverty databases are replete with exclusion errors. This is especially true for urban migrant workers. And I think the analysis of Pakistan's case shows that poverty estimates are largely biased towards rural areas due to the characteristics that are involved in the composite index that is created. The composite index usually has higher provisions for asset scores, and many informal sector workers might actually have a basic asset such as a motorcycle or a television at home or a refrigerator in their place of residence, but which means that they automatically score a little higher on these sorts of poverty assessments. But what poverty assessments are actually not particularly sensitive to are sudden income shocks. And income shocks, such as the one that we are currently experiencing, would push quite a few people, beyond the obviously into precarious conditions, in particular for subsistence-related issues. Similarly, there are other issues. There's an extensive reliance on self-enrollment, especially of people who already hold national identity cards. People are supposed to send SMSs or enroll themselves through web portals. Again, internet access is not universal. Broadband penetration isn't that high. So really, some of these strategies need to be better thought out. And I think that really brings me to the last point here, which is of voice and visibility of the informal sector in various country contexts, right? And Rachel and Vigo have generally talked about how there are sort of informal sector organizations that can be taken on board as far as decision making is concerned, right? But what happens in country contexts where there is no collective action among informal sector workers, or there is very sort of localized or diffuse collective action, right? What happens in places where you don't have sort of the existing associational or requisite associational infrastructure required to actually link up the current experiences of vulnerabilities that are encountered by the informal sector and sort of translate that to the government itself. I mean, in Pakistan's case, I think it's particularly clear that the biggest stimulus effort of about $8 billion that we're currently seeing is biased towards the formal sector and the banked population. So I think the voice part is particularly important, and I think it speaks to key long-standing political economy constraints that the informal economy faces. And I think that this is an opportunity in some ways to actually broaden the conversation and to sort of revisit some of the social protection legacies that usually are biased towards employment in formal sector firms or are sort of simply biased towards bigger or better organized actors. So what do we do about countries where the informal sector is largely unorganized or doesn't have the same kind of political voice, right? So I'll leave it at that. But I think just the last point here would be that I think while a lot of the responses that we see are quite universal, when a lot of countries there's an isomorphism almost in terms of how countries are responding to the crisis. But I think the underlying exclusion errors in particular, and also the validity and the voice aspect of who's actually being able to contribute to these conversations, I think that is differentially distributed across different countries. And I think that's where research can possibly play a role in identifying and highlighting some of these vulnerabilities that might get missed out in the way that regular politics actually functions. Thank you.
Great, thank you so much. It's really interesting to hear more about the context in Pakistan, particularly thinking about the vulnerabilities of different types of workers and some of the biases that may be embedded within responses and how that may relate to comparative context. So thank you so much for that. We'll now move to our final panelist, Gerard McCarthy. He is a postdoctoral fellow at the Asia Research Institute at the National University of Singapore. He has done extensive research on political institutions, on market reform and inequality in Myanmar. And I know that he's been thinking deeply about how to go about setting up research projects to track the socioeconomic and political consequences of COVID, particularly in thinking about the trade-offs between containing the virus without worsening economic precarity for informal sector workers. So Gerard, I will hand the floor to you.
Thank you, Vanessa. Thank you to Max, and thank you to the Institute for ICTD for hosting me for this this seminar and bringing us all together. It's been tremendously productive to just hear the whole range of different experiences and the consequences of COVID as it's been processed in different contexts. So I just want to start with this image, which is a group of women who've been protesting for paid leave during the time that the garment factory has been shuttered in Yangon, and they've been on strike for a few days. And I think it kind of provides an interesting insight both into how the global impacts of COVID on especially garment sector workers who are, in this case, not entitled to any of the formal leave schemes in the factory that they work, have in many ways been affected before anyone else in terms of before the actual virus hitting Myanmar. Just to give a bit of context, the informal economy is estimated about 50% of Myanmar's economy, if not more. Myanmar's population is 53 million. COVID's impact on the informal economy in Myanmar and on Myanmar more broadly arrived well before the virus actually took off in the country. So as of today, it's only 85 confirmed cases in Myanmar and 4 deaths related to COVID. But as I'll mention, there's a lot of issues there in terms of the kind of health dimensions of testing and health system capacity. But from mid-March and earlier than that, there were very clear indicators of the impacts of COVID as a kind of global phenomenon hitting the informal economy. So two very clear indicators of this was migration from Thailand, the return of people from Thailand who were fired from garment factories. So at least 300,000 people have crossed the border, but there are millions of Burmese workers in Thailand without any kind of formal protection. And there's strong flows of people continuing to cross that border. They have shut the formal borders, but there's been a lot of informal border crossing that's continued in the last couple of weeks. Obviously, a disproportionate number of those are women. These migrants have been viewed as potential vectors of disease, but there's been very little focus on their role in remitting. Rural households, 70% of rural households receive remittances from abroad, and the rural population comprise 70% of Myanmar's population. So the loss of remittances is going to be catastrophic for a lot of rural households over the coming months. There's also been huge internal migration. So villages in the Irrawaddy Delta, which were decimated in a major cyclone 12 years ago, many of those very highly affected communities, then households migrated to Yangon in the last 5-6 years to take up garment sector work. And in the last week, reports are that maybe 7 out of 10 of families who left villages after that cyclone to take up informal sector work and garment sector work in Yangon have now returned and view that work as those returns as indefinite. I don't know when they'll be going back to take up jobs in Yangon. So there's been huge internal migration as well as international migration. And the earliest rapid surveys, which a group that I'm working closely with called Opportunities Now in Myanmar, fielded a rapid survey from the 2nd to the 5th of April, which found that 60% of households, this is a 4,000 respondent survey across 6 cities in Myanmar, 60% of households have lost employment and 40% of micro and small enterprises have shuttered as a consequence of COVID and the demand impacts. The current policy responses, just to give you a sense, have been heavily health focused and also heavily population control focused. So the government's been making pretty significant efforts to try and expand, so procure PPE, expand testing and treatment capacity. But we're dealing with an already overstretched health system that has been starved of funding for a very long time. The population control dimensions, especially with the internal and international migration that has been going on, has resulted in hundreds, thousands of quarantine centres being established around the country, and over 50,000 people are currently in quarantine across Myanmar as of the 13th of April. Many of the state of those quarantine centres are often extremely poor. So the vast bulk of those people in those centres are informal economy workers who've been dismissed or their businesses shuttered, and then have had to then migrate as a consequence. There's also been lockdowns of Myanmar's major cities, Yangon and Mandalay, and similar kinds of measures of different kind of variety, which have been implemented in state and region capitals and in towns across the country as well. The economic measures, as we sort of has been a recurring theme of the other presentations, have been heavily focused on the formal sector. So the central bank has lowered interest rates. They've announced at this stage only $35 million fund to provide 1% loans for formal sector businesses. And there's also the promise of income and personal tax remissions. Of course, Myanmar has the lowest tax to GDP ratio in ASEAN and one of the lowest in the world, given especially the size of the informal economy. There have been very limited social protection actions, and especially for informal economy workers. There's been 10-day ration packs that have been distributed in the past week to those who are considered to be the most vulnerable within specific localities. That budget derives from the Ministry of Relief, Resettlement and Social Welfare, which is historically the least funded department in the ministry in Myanmar, and is chronically understaffed, but also doesn't have a logistical bureaucratic presence below the township level. So its capacity to distribute, to identify needs at a local level is really constrained. There's also been no mention yet, as we've heard in last presentations, for example, and in other contexts, of expanding very limited skeletal apparatus of direct cash transfers in Myanmar. For example, there's a maternal cash transfer 1,000-day grant, which is given out, and a very small amount of money for the elderly. But those programs have not been, there's been no discussion of expanding those at this stage. So the informal economy has been massively hit, and yet paradoxically it has been central to the response at a localized level. So businesses, especially micro and small businesses, community organizations, monasteries, churches, have been playing a major role in food and aid support to those even more vulnerable than themselves. So non-state actors in many ways have been integrated, if not leading, the local response efforts in terms of setting up quarantine centres and being, establishing case tracing efforts at a local level. We've also seen the involvement of local small business people, some of which may be formalised, but many of which remain in the informal economy. The involvement of those business people and community organisations on government COVID response committees at a local level. The government response already relies heavily on those informal actors. For example, the government is providing a 7-day ration allocation for returning workers when they're quarantined, but they're quarantined for 21 days. So the government ration pack is only covering them for a third of the time that they arrive back, and presumably their family and other organisations are meant to take on those responsibilities of providing for them. So we see this sort of systematic reliance on community donations, charities, religious institutions, which is reinforcing an insecure and precarious welfare regime, which has been the larger research that I do demonstrates how this has emerged since the collapse of socialism in 1988 and the transition to this form of militarized capitalism, oligarchic capitalism since through the 1990s. So there's a clear need for a more robust state response, whether that looks like expanding social protection through direct cash payments to specific populations, extending in-kind aid where supply chains have been disrupted, and major investments in public works, for example. Myanmar has a significant backlog of infrastructure, and that may be one way in which to provide employment opportunities at a localized level to informal sector workers. But what kind of interventions are necessary and where, and how to implement them, and what's the impact? Things that there is really not sufficient research at the moment. So I just want to kind of raise a couple of key questions here. The first is that I think social research is critical to informing the COVID response in Myanmar, but from the sounds of what we're all recurring, that's critical. And this is especially important because many of the narratives and public discussions about COVID is framed around testing and the capacity to measure the effects of lockdown consequences on the flattening of curves and data-centric capacities that come from highly developed health systems, i.e. as the numbers drop, that lockdowns can be eased. In the context of Myanmar, the very weak health system capacity means that spread or impact of lockdowns or the consequences and their effectiveness is very hard to track through testing. And that raises this question about how do you inform decision-making about the response while reducing the impacts on the informal sector and providing, where you can, social safety nets. We know that work by colleagues like Vanessa and others at pandemics such as Ebola often see a worsening burden on the most vulnerable and informal households. That's been a recurring feature of all of the presentations. And the questions then become, how do you provide a basis for advocacy around broadening social protections? How do you measure the consequences of cash transfers that are provided and other payment initiatives on the precarity that's been exacerbated in the current context? And how do you track the politics of welfare, of informal taxation in particular, which we're going to see a massive expansion of, as we all expect over the coming months and years, both from state and non-state institutions. And how do you collect fine-grained data which tracks the impacts over time of COVID and of the response efforts, and how do you use that to inform policy? So obviously multi-wave tracking data is going to be really important, going back to the same people and trying to assess what that the impacts of COVID and all of the economic and social upheaval that it brings, what does it actually look like for households? So tracking that over time is going to be really important where we can do that. Quantitative data needs to be coupled with a study of the mechanisms and processes going on, and especially qualitative interviews. These sort of rapid snapshot surveys aren't necessarily going to give us an idea of the granularities of the politics of voice and negotiation that might all be happening at a local level in many cases. So the second kind of question then becomes, how do you do responsible research in a time of COVID, and especially in Myanmar, where face-to-face interviews are obviously very risky and very inadvisable in the current context. You don't want your research interviewers being exposed to potential risk of spreading the disease or picking it up. So how do you contact respondents and build semi-representative samples, especially of the informal economy? So just kind of kicking around ideas with collaborators in the last couple of weeks, there's a few kind of options that we've come up with. The first is just straight phone interviews, right? So do partner organizations that we work with have existing phone databases of informal economy workers or just of households where on average that we know that there's going to be people employed in the informal economy in many households, and how do you think about a representative sample of that from a gender perspective, urban rural perspective, etc. A second option, and this is something that's been done by JPAL in Indonesia, is Google surveys, which they've set up 500 household Google survey that goes out every week, which is tracking employment, food, migration, and access to services. I've got a link to it in that PowerPoint. I can share the PowerPoint with those who are interested. But Google surveys is not available in all contexts, and obviously there's a lot of limitations, as we've already spoken about access to even access to Google services in different contexts. Google surveys doesn't operate in Myanmar, but also access obviously to internet and access to those surveys. So a third option outside of Google surveys, if you don't have Google surveys in your context, would be online surveys, which gives you the strength of a more formalized structure, but then it's also challenging gathering a representative sample in many cases. So the fourth option, which sounds a bit wacky, but it's one that we're strongly considering in the context of Myanmar, is what we call chatbots, which is conversational artificial intelligence. I'll just go over this very quickly. So I'm sure you've probably all seen chatbots in on your banking website if you haven't already encountered them before. But basically, one of the things that we're exploring is whether it's possible to develop a semi-representative national sample, conducting rapid snapshot surveys using what the kind of interactions that is on the side of the right of the screen here. Basic conversations between a chatbot, which is loaded with questions, basically survey questions with maybe 2 or 3 different kind of responses, and getting an indicator from that of a few very basic kind of measures. Have you gone into debt in the last 2 weeks? What things have you gone into debt for? Things with 2 or 3 or 4 options, probably not more than about 5. You can have capacity to solicit basic information very rapidly. It can be used also to disperse information in a two-way flow of information. So providing links to COVID-19 health advisories is something that our partner ONOW has been doing, Opportunities Now Myanmar has been doing in with their rapid surveys that they've been doing. And it's also being used by the World Health Organization. So Myanmar is a somewhat peculiar case in which 80% of the population, as a result of a very late digitization and liberalization of telecommunications, 80% of the country have smartphones. Obviously, there are geographical and social strata limits to that. But this could potentially be useful for a very rapid survey, and we know that we're getting some of the best metrics and sort of detail, especially from rural areas where it's socially responsible to send people, very good indicators of debt, how much debt people are going into, returning migrants, this kind of data, and it's very cheap. 1,000 completions in 2 days for less than $500 across 6 cities, which is tremendously low, tremendously cheap, obviously. There are limitations to it, as I noted, but there's also a lot of opportunity for expanding this into a more phone-based interview sample, right? So you can ask, and as our partners have done, asking for phone numbers at the end of the interaction and then calling them up, either confirming the data, but also having more in-depth kind of qualitative conversations about mechanisms, processes, whether they've received different kinds of grants and the impacts of them. The number of different projects, ideas that are coming out of this kind of question about a mixed methods, sort of chatbot qualitative combination in the context of Myanmar, rapid national snapshots that could be done weekly, but broken down regionally to provide advice to government about where and what sectors and regions are encountering different kinds of impacts, MSME and informal sector studies specifically about businesses, as well as more in-depth sort of qualitative and potentially digitally ethnographic studies of governance diaries of the poor. How do people interact with different authorities, access different kinds of schemes and authorities at this time? So it gives you very, very broad ideas of some of the ways that we're trying to sort of Rubik's Cube some of those complicated problems of methodology and surveying in a responsible way in the context of Myanmar. Thank you.
Great, thank you so much, Gerard. Really interesting to hear more about the context in Myanmar, but also to see how some similar themes are really obvious across different contexts in terms of the vulnerabilities as well as the responses. Also really interesting to hear some of your ideas about how to go about collecting research at this time. I should also thank you as well for joining us from Singapore, where it is probably your bedtime. So thank you for staying up late to share your thoughts. Now, thank you to all of our panelists, though that opened a really, really wonderful discussion. We're very lucky to also have two wonderful discussants. We're going to try to keep the discussants' time fairly short so that we still have time for an open discussion. We'll ask each of you to stick to about 5 minutes. The first discussant that I would like to introduce is Christoph Tiedeke. He is a senior lecturer based at the Institute of Development Policy at the University of Antwerp. And he has done extensive research on governance and conflict in spaces of weak state, where there is a weak state institutional presence. He has particular expertise in Central and Eastern Africa. Thank you, Christoph.
All right, thanks, Vanessa. I'll be very brief. I will not take 5 minutes. I would just like to highlight some main points or some major issues. Because it seems, well, to me, it seems that the current COVID crisis acts as a kind of magnifying glass to highlight what could be considered major issues in research on informal economies, or even on research on these issues broader. So first of all, throughout all the discussions, it is highlighted, well, what is a major theme in research on this issue? Well, what does informality mean in these circumstances? You know, what is the relevance of the term? So on the one hand, the crisis could be used to say, well, is this really about informality, or is this about situations of what could be termed high vulnerability, difficult livelihoods, about having access to health, access to security, and so on? Some of the some of the figures which were presented kind of highlighted that. Also in Pakistan, it was 72% of non-farming households which were informal. In Myanmar, over 50%, and so on. If it's that dominant, you know, what does it teach us, both analytically and policy-wise? On the other hand, it could be argued, well, this crisis actually shows the relevance of this term, because it highlights, well, and as Kate's work has shown extensively, it highlights particular political dynamics at stake and social dynamics, or I forgot who said so, even the spatial dynamics of informality. And one thing which kept coming back throughout the different presentations was the issue of voice. The wider literature on informality has shown, well, I think it was Rachel who said, well, an institutionalized dialogue is more difficult with informal workers. And as I had been shown, voice, it's mainly through personalized linkages, through patronage, through linkages with particular politicians, and so on. So what does this mean in the current circumstances? What does this mean for a dialogue or for a quote unquote social contract? What does this mean for interventions? How do you evaluate interventions if it's not possible to have this kind of institutionalized dialogue? What does this mean if the current governance structures worldwide are strongly tilting towards more authoritarian structures? How do you activate your personal linkages if there's this tendency towards a centralized government? What does this mean for the scales on which informality is working if there's a strong push towards centralization? And how do you evaluate these interventions? And perhaps lastly, well, what does this tell us? It was mentioned in a couple of presentations. What does this tell us about how we go about in actually doing research? Also here, it can act as a magnifying glass. If we are forced to do some kind of remote control research, how do you guarantee that it doesn't further tilt power relationships towards inequality? How do you make sure that not the most vulnerable are actually pushed to go out in the field and collect data? How do you actually keep that balance? I'll stop it here.
Okay, thank you, Christoph. Before we kind of open it up to the wider set of questions, I'd really love to very quickly throw to Phil Mader, who's a research fellow at IDS and who's done a lot of work, particularly also on the intersection between informality and microcredit and microfinance. I think bringing an aspect of debt into this and an aspect of financing, given the especially also the medium to long-term outlook of the crisis will be really important. So I will throw it to Phil.
Thanks, Max, and thank you everyone for these really insightful and fine-grained impacts. Just to briefly highlight two cross-cutting issues related to the informal sector and the financial system, I want to say something briefly about the pressures of debt on informal sector workers and low-income families under these circumstances, on top of all the disruptions that we've already talked about. And second, the effects of apparently growing fear of cash. So, it's clear that low-income people and workers in the informal sector are shouldering significant debt burdens already. As households, they often have negative financial net worth, and additionally are at risk of falling into debt quite even quicker than others and taking longer than others to get out. And they're less likely to be reached by many of the financial and macroeconomic relief efforts, as some of the speakers today have noted already, that have been put underway by governments. So several governments have already reacted and instituted things like debt moratoria, or announced relatively vague slowdowns in repayment plans, but these are often voluntary, and it's unclear to what extent banks are complying with them. From India, I can report that the microfinance industry body has said that the microfinance institutions it represents have passed the benefits of a moratorium on to micro borrowers, a moratorium that the Reserve Bank of India has allowed banks to give. But in turn, a lot of the banks that have lent to microfinance institutions still are actually charging on the loans that they have made to the microfinance institutions. So it's probably just a matter of time until the MFIs in India pass the pressure on to their borrowers. Again, meanwhile, in North Africa, the Egyptian government has stalled some payments. In Morocco, there seems to be another debt problem brewing. So the Committee for the Abolition of Illegitimate Debt has already called for cancelling microfinance loans, because precisely those people who work in the informal sector have not been reached by what the government has put in place to a system whereby it's regulated for large formal banks to defer payments to people who have lost their jobs. But if you're working in the informal sector, you're not counted as having lost your job. And the second thing I wanted to mention is a fear of cash that is likely to be a major problem for large parts of the informal economy in many countries, because informal sector businesses and more generally poorer sections of society in most developing countries rely on cash payments for a variety of reasons, including technological barriers, but also literacy, convenience, habit, and simply the higher cost of digital payments. So a few weeks ago, there was quite a gross misrepresentation of WHO guidance by actually the UK's Telegraph newspaper, which forced the WHO to lodge an official complaint that they did not say cash was transmitting coronavirus, and to clarify that they're not actually promoting the use of contactless payments, as opposed to what the Telegraph had reported. The message from the WHO is simply to wash your hands after making any sort of payment. Because from what's currently known, the virus actually lives longer on plastic or metal surfaces than on cloth or paper. But still, many people and businesses around the world seem to have unilaterally decided to no longer engage in cash transactions. And at the same time, payment industry bodies like the Better Than Cash Alliance have taken the pandemic as an opportunity to promote digital payments in developing countries. For instance, proposing things like that digital wage payments to health workers would be the key to keeping health systems running. Now, it may be true that digital payments can be helpful in such ways, but it's really important that they are just part of a plurality of payment rails rather than a single monopoly payment channel, because the devastating effects of disrupting cash payments could be really seen just a few years ago in India's disastrous demonetization experiment in 2016, where the economy ground to a halt. And even possibly more than 100 deaths were directly attributable to the inability to access and pay for basic services. So just to mention these as additional pressures that are on the informal sector, people shouldering debts that they struggle to repay even more now and may be pushed into quite unfortunate situations of indebtedness further. And secondly, struggling to make any sort of payments that are necessary to survive if cash is officially or unofficially being kind of removed from the picture.
Thank you very much, Phil. So we're gonna switch to questions from the kind of the wider audience, which includes the rest of the people on the Zoom call, but also I think earlier was 175 people on YouTube. If you do want to ask questions, if you're on the Zoom call, if you just want to write them into the Zoom chat. If you're on YouTube, if you want to write them on the comment section, and Steph will pick them up and also add them to the Zoom meeting so we can see them. I think the procedure might just be that Vanessa and I pick out questions from those chats and kind of throw them to the panelists. So it would be ideal if your question would include a brief statement of who you are and your affiliation, if you like, or if this is directed to any particular panelists. Your question can be a statement. It just makes it less likely that we'll pick it up and ask the panelists. We will try to get to as many as we can. We're a little bit pressed for time, of course, but in that case, we'll just start. And maybe I'll pick up one question from Will Monteith, who asks, what are the most appropriate scales for intervention, national versus municipal? Do municipal governments appear to be more responsive to the needs of informal workers than others? It's not directed to anyone in particular, but maybe especially from the kind of maybe from the more activist side. Maybe Rachel, do you think there's a trade-off here between working on a more national level or an international level, as Viego frequently does, or on a local level?
Actually, we have a lot of work grounded in cities. So we do see the value of working at the municipal level. But I would say that it really depends on what kind of intervention you're talking about. So if you're talking about cash transfers, much of that is determined at the national level or, in federal systems at the state level. But it is obviously, in many cases, above the municipal. Talking about the redistribution of food rations, then yes, the municipal level is probably effective to target. Also, if you're talking about the classification of who is an essential worker, who should get protective gear, who should not, I would say that classification can be done at the municipal level. We've seen examples of both at the municipal and national levels, directives being given around that. But in terms of the actual access and distribution, of protective gear, that would probably happen at the municipal level in negotiations with the municipalities. I think I would just say that it really depends on what interventions you're looking to influence and who then is your interlocutor within government.
Great, thanks. So another question targeted at Rachel, but I think that will be relevant to other panelists as well, from Sylvia Garcia Teles. She asks about some of the complications of doing research in this area and perhaps some of the fears that informal workers may have in engaging in this research, particularly in thinking about backlashes from governments or some of the tax measures that could be imposed on them as soon as government may have more information about them. So if anyone has any particular thoughts on those particular challenges.
Just on this question of, just a quick point on this question of sort of conditionality of documentation being attached to the kind of assistance that it's being made. I think that's something that a lot of governments, at least that government in Pakistan is also sort of considering. It's something that they've been thinking about, that you somehow tie assistance to informal sector enterprises sort of coming within the realm of documentation. And I think that's a it's a very tempting thing, but as Max highlighted at the start, that this is something that policymakers and activists need to be very wary about, that whether this entire sort of crisis is somehow not taken into a very different direction and it doesn't become a source of extraction or tax extraction, which already sort of pushes, which will have its own sort of negative impacts and adverse consequences on informal sector enterprises. So I think it's certainly something which is part of the conversation. But I would think that it is a pretty major red flag as far as sort of the precarity of these of the workforce is concerned.
Just to add to that, I think it's, I certainly agree with that point, and I would only add that I think we need to make a distinction between informal workers and informal enterprises. So when you look at when you look at the self-employment within the informal economy, let's take Africa for instance, 63% of informal workers are self-employed. That 63%, only 2% of that of those informal workers are employers. 46% are actually own account workers and 15% are contributing family workers. So you can basically assume that the own account workers and the contributing family workers have no capacity to pay income tax or any form of corporate tax, but also that even those own account workers are paying, for instance, if they're working in a market or working on a city street, they are paying some sort of form of taxation, and Kate can speak more to that and others as well. So I think we need to be careful about not confusing enterprise and workers, and recognizing that many workers would fall outside of the sort of direct taxation, but that they are also contributing in other ways, in licensing fees and market dues, which may not fall within the tax system as it's defined. So I'll leave it there for others to add as well.
Can I just jump in and make the point that I think it's something that I've done a lot of work on in the context of Myanmar, is conceptualizing the contributions that payments for welfare services and essential things that in many other cases are provided by the state, social welfare protection at a local level, are often funded through the mechanisms of donations and redistribution that's occurring. And I think it's also important that we need to look at that mechanism, which is going to expand massively over the coming months in terms of providing people who are already the most vulnerable, also simultaneously being the source of social protection for those around them. And that needs to be conceptualized as a form of informal taxation in contexts where governments are not willing to fill those breaches, and in the context of countries refusing to provide stimulus packages or social protection schemes. So I think it's worthwhile, raising those localized social protection schemes within a larger conversation about informal taxation as well.
If I can just come in on that for a sec as well, I think sometimes people get a bit caught up in definitions and fail to recognize that most informal actors already pay tax. They pay, as somebody has mentioned, market fees. Most informal workers in African countries have been paying tax at the local government level since the late colonial period at the very minimum. As was already indicated by Gerard, they also pay all kinds of social contributions. And it's these informal associations and kinship networks, et cetera, to which they pay self-help social contributions that are being asked to take up the slack to fill in the gaps for the food rations. Certainly in Nigeria with the lockdown, many people who can't get enough food, who have to work every day for their food, simply rely on networks who get food to people who need things, kinship networks, friendship networks, etc. So there's a huge amount of informal taxation as well as ongoing formal taxation that already takes place. And this fixation with widening the tax base by focusing attention on vulnerable workers who already pay various types of formal and informal tax, and turning away from the people who have all of the resources. The very idea that Donald Trump would say that people should stop paying into the formal sector social welfare contributions so that people can have more cash in their hands, ignores the fact that the tax system, formal and informal, is a fundamentally redistributive system. The idea is that there are people who are below the tax threshold but they still merit various types of social support and income. And there are people who are very high up in the tax bracket who are the most important source of taxation. And I think we've all seen over the years that there are many concerns about the ways in which people at the top are paying less tax. And in order to replace what's lost, we're turning to the people at the very bottom who have very little to contribute and already pay quite a lot.
Okay, without, because this would be frivolous, mentioning that we do have a piece on taxing the informal economy coming out next week, I'm gonna pick up a question by Cyrus Policarpio, who asks, while we understand that universal approach to cash food assistance is ideal, however, the resources could be limited to cover all. As such, is segment-focused assistance a better option? Or to kind of maybe tie that to the point that Kate had in her presentation was that there is a trade-off here between different policy options, right? There's a trade-off between targeting and more kind of universal aspirations or approaches. And there's both for kind of activists and for governments, there are priorities to be set here. So maybe I will throw that question to the panel.
If I can start the ball rolling there, certainly the resources to cover cash transfers. One of the things that many people have been asking in South Africa and in Nigeria that I've heard so far is that if the government had all this money to bring out to pick up all of these new costs, income replacement, et cetera, if they had this money all along, why are we only hearing about it now? Why suddenly are we hearing that resources can be mobilized to meet these needs? But up until now, we were being told there was no money, we need austerity. So there's a certain extent to which the issue of whether there is enough money is a bit of a spurious issue. Whenever somebody decides that the issue is important enough, money is mobilized, and money can be constantly mobilized through a progressive tax system, so that you can do a universal basic income and then tax back from the higher income brackets. Very easy, no issue of targeting. There are varieties of ways through tax systems, through monetary systems of raising resources. It's more a question of priorities than of lack of resources.
That seems to have answered the question very well. So I will throw a couple questions. I'll try to summarize them together. Going back to the conversation that we were just starting about community-based approaches to response efforts. So linking to what Gerard was talking about in the context of Myanmar, about how charity and informal taxation, the burden of responses is actually shifting to individuals and communities through those mechanisms. So Jadabas, and I'm sorry if I mispronounce your name, she's asking how the role of community-based approaches, what role it can play in supporting the response especially for rural and hard to reach populations. But relatedly, Damilola asks, in contexts where there are no records and there's no formal and existing ways of dealing with informal sectors, and particularly in contexts where community-based organizations like churches or mosques or civil society organizations are not accessible or are not operating under lockdowns. Are there ways that, what issues does this present for social welfare provision in the crisis period, but perhaps also for shifting state-society relations in the post-crisis period? So maybe directed specifically to Gerard, but also, of course, more broadly.
Thank you. I think there's a really big question here about the role that community-based organisations and localised, kind of what Kate was describing, the sort of mechanisms of reciprocity and kinship at a local level that then begin to formalise. And I think they're especially critical in contexts where the formal apparatus of state aid is very weak, and especially in a Myanmar context, contested areas where the trust in government authority, which is already fragile in kind of lowland areas where government administration is stronger, those community intermediaries are going to be particularly critical in providing a bridge between ethnic armed groups and the government in how to provide. I mean, there's obviously the health response side, and in the Myanmar case, there has been some collaboration between the government health systems and ethnic armed groups and ethnic health systems. Many of those armed groups also run their own affiliated health systems. But it's, I think that we're going to see a particularly important role for religious organisations and those community organisations as collecting information about who the most vulnerable and most impacted are in those contexts. And it's something just worth kind of flagging. It's in those contexts in particular where, at least in the Myanmar context, that those areas have been the highest migration. So huge numbers of people in those contested regions have moved to Thailand over the last 2-3 decades for work and have now returned, many of them. And so those are areas where those community organisations are going to play a particularly critical role in bridging between different authorities and brokering assistance. And in many ways, there's a lot of potential politics there, as sort of Christoph mentioned earlier, the sort of patronage and clientelism in areas of sort of informal authority as well, of armed groups potentially and government authorities contesting over who gets to provide COVID support to different areas of the country. So I think that there's a whole variety of different dimensions to that role, but it's going to be particularly important in those contested regions. Yeah.
Maybe just quickly to add here, I mean, I said it in my presentation, and it's certainly a way in which we see our work in sort of strengthening member-based organizations of informal workers, and many of them are being called on right now to provide some of this community support, be it food rations or registration for cash transfers. But I do want to stress the sort of that community structures can also be hierarchical and patriarchal. And so just being very careful about, or at least understanding the limitations, that this may be a temporary measure, but that there is a reason for why social assistance is not delivered through community mechanisms in most cases, that there is a reason why this is actually structured through government. And many of the countries that we've mentioned in this discussion actually do have some form of cash transfer that is coming from a national level. So, but that design is intentional in that we have seen that going through community structure or community structures as they are doesn't necessarily work. So that sort of short-term versus long-term, how do we think about the role of community structures now in sort of active response, but how do we transition out of that? Because that's not a sustainable response, but also not a structural response. When we're thinking about building social protection systems, financing social protection systems, and thinking about taxation and its role in that. So I'll leave it there. Maybe others have something to say.
Yeah, I just had two very quick points to add to this. I think the first is I completely agree with the responsibility of the state here. I think the first thing that I wanted to flag was that this is obviously a lot of this is predicated on the existing landscape of or organizational landscape of philanthropy that exists in different countries, and I think that there's a great deal of variation across different countries in terms of what kind of actors are available. I think linked to this, I think we also know that where it is possible, community and kinship-based networks would already be supporting vulnerable households, and they're probably already being tapped to cover up at least some of the subsistence-related crises in particular that we're facing. But I think again, the exclusions, the hierarchies that are often associated with these networks, I think that's a completely valid risk to identify, which is why I think as a policy position, I think community-based interventions should be supported. They should be encouraged. But I think the final responsibility ultimately rests with the state, and the resource quantum that is required is also something that only the state, as Kate has already identified, that only the state can actually mobilize. So I think we need to be very careful about how we phrase the differential importance given to each kind of intervention and who the actors leading that intervention is. I think the buck does stop with the state as far as a crisis of this particular scale is concerned.
Okay, I think I'll try to slip in one final question before we're running out of time. We've had earlier discussions about the kind of the newly essential or the visibility of some informal actors. There's been quite a few questions in the chat and in the comments on YouTube also around stigma and informality in the context of this pandemic. There's one question that asks, the fishermen of India are highly affected because of the fear generated towards their identities. What can we do to address this, and are there other countries facing similar examples? Again, I think that could be to the entire panel.
The whole idea of stigmatizing informal actors or particular groups within informal actors, if I understood the question particularly, I think is a big problem, because informal actors are becoming visible in particular ways, becoming visible as crowded people, as people who touch money, as people who come out into the world when people are asked to stay home. So there are many ways in which what is happening now, in addition to putting informal operators much more on the political agenda, is also drawing a lot of attention to the ways in which they will be seen increasingly as, I think it was Gerard who put it very interestingly, as vectors of disease rather than vectors of remittances. And as various types of value chains and informal activities close down, their ability to serve as the sources of income, dispersing it into communities, will weaken. And the dangers that they pose to the wider society in terms of health conditions, in terms of their living conditions, their economic activities, etc., will be increasingly emphasized. And I see the real dangers in increasingly right-wing populist states, where religious practices, particular types of activities that one wants to clear out, will simply be targeted as something that involves a negative community or a stigmatized community, a stigmatized activity, etc., can be easily targeted for repression. So I think there are a lot of risks in the kind of visibility that is taking place, and that there is a real need to be politically aware of how the informal economy is shaped in terms of its relationship with these diseases. And that might be, might signal some of the ways in which informal organization, informal unions may think about how better to adapt public health responses to actually be practicable in informal contexts, so that people can respond to public health concerns in ways that are useful, rather than in ways that are simply a response to their own risk profiles.
Okay, I think I will have to kind of end the discussion here, unfortunately, and start some final comments by thanking the speakers for making the time, for some of you getting up very early, some of you staying up quite late to join us, as well as the vast number of participants. I'm very sorry that we weren't able to address all the questions, but even as someone who spent the kind of last few weeks talking to some of the other people on the panel about this, I was really amazed with how many new things came out in this, and I've learned a lot today. I thought it was incredibly visible again how much crisis can make some things visible that were always there, but we had to spend so much time pointing out. And I mean, kind of both the way that informality overlaps with wider globalization. I mean, I think the point came up in multiple presentations that there was a crisis informality before kind of it was a crisis of infection in these countries, because it's so embedded in global trade links, but also the way that this crisis has once again brought out differentiations within the informal economy, right? The newly essential and the newly even less visible. As well as, I think, in the final discussion, the degree to which all of this is still connected to the state. And I think we'll see both in developing countries, but also in developed countries, once this immediate wave of crisis and relief is over, a new discussion around fiscal relationships and a new discussion around how this will be paid for, how healthcare will be organized, who's been excluded and what we've learned from that. And that there's a role for a discussion about the informal economy in this, and I think a rediscussion of issue around formalization and taxation. But I will resist the temptation of taking up any more of your time and just say that we didn't quite knew what this was going to be. I mean, I mentioned in the beginning that we originally thought this was going to be at about 12 people in a Zoom room, and now it's been multiple hundreds. So we also didn't really quite know what was going to happen after this, or what should happen after this, if there should be more discussions about this, if they should look differently, if there should be more research. So I think I will leave it as, tell us. I mean, if you've enjoyed this, if you've been a part of this, if this has raised new questions, feel free to get in touch with us and also kind of tell us what you think this should be here from here on. Also, I'm told that the people who joined on YouTube were unable to see any links that were shared and had trouble seeing some of the slides. So in that case, I would like to say that we will try to put, for any of the speakers who shared their slides, put the slides on the ICTD website. We will also try to put any links that were shared throughout this, including, I think, to Rachel's report, on the ICTD website. There's also on that website a call for papers. We're currently accepting proposals for research projects in this area if someone is working on something like this. But most centrally, once again, thanks very much to the speakers for making the time. Thanks for all the questions. And this has been really, really enjoyable for us, and I hope for the participants as well. All right, thank you.
Thank you, Max. Thank you, Vanessa.
Yes.
Thank you all for joining.
Bye.
Thank you.
Great.
Thank you.
Thank you, everyone, for joining us.